First, we're going to look at a number of diseases that are caused by different herpes viruses. Generally, these viruses cause lesions and lead to serious complications in immunocompromised patients. They're treated with acyclovir, and however, once acquired, they will stay in your system forever. The first disease is known as varicella, also known as chickenpox, and chickenpox is common in young people and is distinguished by lesions found in varying states from papule to pustule to crusted over lesion. There is a live virus vaccine available for this disease.
Herpes zosters, aka the shingles, is caused by a reactivation of varicella zoster from the chickenpox. It is most common in individuals over age 50 and is distinguished by a unilateral rash along a single dermatome. There is a vaccination available for this, and it's recommended in patients over 60 years old.
Our next disorder is herpes keratitis, which is characterized by dendritic lesions inside the eye. You can see here it's visible under a slit lamp exam with fluorescein drops and can lead to encephalitis in immunocompromised patients.
Herpes simplex virus 1 and 2 causes herpes keratitis and can also cause lesions in the genitals, oreolabial, herpetic whitlow on the fingers.
This is cytomegalovirus. It is caused by human herpes virus 5. It is usually asymptomatic but causes conditions in the immunocompromised, such as retinitis in AIDS patients and pneumonia in organ transplant patients. This is the only condition in our presentation that is treated by ganciclovir.
We just concluded discussing herpes viruses, which are more severe in patients who are immunocompromised. So now we will go into immunodeficiency. Let's talk about HIV. So how do you decide someone has HIV? Well, their CD4 count has to be above 200. They are positive HIV serology, which is determined via ELISA, E-L-I-S-A, and confirmed with a test such as Western blot, and they do not have an AIDS-defining illness. Moving on to AIDS. There are 3 ways that you can diagnose a patient with AIDS. First, they have an AIDS-defining illness alone. There are 11 of these. We will discuss the most common. Or they have positive HIV serology, the ELISA with the Western blot that we talked about, and they have a disease that is very common with HIV patients. The third and final way is they are HIV positive on serology, and they have CD4 count less than 200, so it's going down, or their CD4% is less than 14%. When a patient first has AIDS, it usually presents as, quote, the worst cold I've ever had. This is called the acute retroviral syndrome. These symptoms last over 2 weeks. Fever, chills, wasting is a very distinctive characteristic, so they're losing a lot of weight unintentionally. They have nausea, vomiting, diarrhea, again over 2 weeks. They have a maculopapular rash. Then moving on to chronic complications of AIDS. The most common malignancy in AIDS is Kaposi sarcoma. We talked about herpes viruses. This is herpes virus 8. It is a violaceous plaque. And moving into opportunistic infections that can affect AIDS patients. They get more severe as the CD4 count goes lower and lower. Starting with these infections that occur in patients who have CD4 count below 500, some of the common ones are hairy leukoplakia. This is very common in AIDS patients with this CD4 count only if they are not smokers or they are not Ashkenazi Jews, then you would suspect AIDS if a patient came in with this whiteness on their tongue that you cannot scrape off. Also, Kaposi sarcoma in patients under 60 years old is common. Again, we just talked about this being the most common malignancy in AIDS patients. It is an AIDS-defining illness if the patient is under 60 years old. Anything with an asterisk means it is an AIDS-defining illness under these certain circumstances. As the CD4 count drops below 200, you're going to get a couple kinds of pneumonia. These are pneumocystis pneumonia. Two kinds, PJP, which is an AIDS-defining illness, and PCP. These pneumocystis pneumonia are the most common opportunistic infections in AIDS, total. Toxoplasmosis, however, that's in the brain. It's the most common space-occupying lesion in AIDS. As the CD4 count drops below 50, you will get MAC or MAC, also an AIDS-defining illness. CMV retinitis, we just talked about CMV retinitis, being the most common ocular complaint in AIDS patients, another AIDS-defining illness. And finally, CNS, so central nervous system, lymphoma. So you have lymphoma of the brain. And when a patient comes in with lymphoma of the brain and they're under 60 years old, that is an AIDS-defining illness. Remember, AIDS-defining illness, you can diagnose the person with AIDS without HIV serology. It's possessive.
Yeah, and it was the eye infections or whatever.
Quick retraction. The acute retroviral syndrome is most common, will present with HIV patients, not AIDS.
These are the HIV medications. There are currently 6 classes. The backbone is using 2 NRTIs with either 1 protease inhibitor or with 1 integrase inhibitor. So there are 6 classes of medications total that we can use to treat HIV. The first class, NRTI, is the first line of treatment, and some side effects include lactic acidosis and hepatomegaly. One medication, abacavir, we always have to do a hypersensitivity test for it. The second class, NNRTIs, some side effects include rash, hepatotoxicity, and psychiatric illnesses. The third class, protease inhibitors, we always want to use with PKs to enhance the effect of the drug, and they include some metabolic side effects. The fourth class of medications are the fusion inhibitors, and they are usually used as a last line of treatment. The fifth class of medications are the CCR5 inhibitors. The fifth class of treatments are the CCR5 antagonists, which include Maraviroc. And with Maraviroc, we would always want to check for a trophile assay. CCR5 antagonists are also used as a last line of treatment. Last but not least, integrase inhibitors, right here, are also used as a last line of treatment, and they include metabolic side effects. That concludes the 6 medications for HIV. And some ways to prevent HIV are by using condoms, abstinence, such as from sex and substance abuse, and using clean needles. Also, keep up to date with vaccinations and do cancer screenings.